How does medical malpractice violate non-maleficence? Imagine trusting a healthcare provider to keep you safe and healthy. Now picture that trust broken because of a mistake that causes harm. That's where the principle of non-maleficence comes into play. Derived from Latin, meaning, first, do no harm, this principle is a core part of medical ethics. It means doctors and healthcare workers must avoid causing injury or suffering to their patients. They need to carefully weigh the benefits and risks of treatments before acting. When malpractice happens, it directly breaks this rule. Medical malpractice occurs when a healthcare provider's actions or inactions lead to patient harm. This can happen in many ways. For example, if a surgeon makes an error during an operation, or if a doctor misdiagnoses a condition, the patient suffers. These mistakes show a failure to meet the expected standard of care. The standard of care is what a reasonable doctor would do in the same situation. When this standard is not met, and harm results, it's a violation of non-maleficence. One common example is medication errors. If a nurse gives a patient a drug they are allergic to, or if a pharmacist dispenses the wrong dosage, harm can occur. Prescribing opioids irresponsibly, leading to overdose, also breaches this principle. When a healthcare provider does not check for dangerous drug interactions or fails to warn about side effects, they risk causing preventable harm. Informed consent is another key part of respecting non-maleficence. Doctors must fully inform patients about the risks, benefits, and alternatives of treatments. If a doctor skips this step and the patient suffers harm, it's a breach. For instance, if a doctor does not tell a patient about serious side effects of a medication and the patient gets hurt, the doctor has failed to protect them from harm. Professional standards guide healthcare providers to avoid unnecessary burdens or risks. If a doctor chooses a treatment that is more invasive or costly but offers no real benefit, they violate non-maleficence. The Hippocratic Oath emphasizes high standards of care, and neglecting this can lead to legal consequences. Malpractice can also involve discrimination or systemic issues. If a patient faces prejudice or is treated unfairly because of race, gender, or background, it can cause emotional and physical harm. Historical cases like the Tuskegee study, where Black men were left untreated for syphilis, show how racial bias can lead to serious violations of non-maleficence. Legally, when harm occurs because of negligence, patients can file malpractice lawsuits. Courts look at whether the healthcare provider failed to meet the accepted standard of care. When they did, it's seen as a breach of both ethical duty and legal obligation. This connection shows how non-maleficence shapes laws and practices today. In the end, non-maleficence is about making sure patient safety and well-being come first. When healthcare providers neglect this principle through mistakes, negligence, or discrimination, they break the trust patients place in them. Upholding this core value keeps healthcare safe, fair, and respectful for everyone.